In 3, 2, 1.
Good afternoon. I'm John Brumstead, CEO of the UVM Health Network. I want to thank you for joining us today on this historic occasion. It's a historic occasion because in just a moment, we're going to begin the very first COVID-19 vaccinations here in Vermont. And with these vaccinations, we mark the beginning of the end for this terrible pandemic. Because of the pain and suffering and disruption that COVID has created, the message today is one of hope and looking forward. And for me, having spent my entire career in academic medicine, another emotion is one of intense pride. Pride in our scientists, pride in our clinical scientists who have brought us this vaccine in such record time, and of all of our clinicians that today start the process of delivering that vaccine. The folks that you see here today in Davis Auditorium, the women and men who will receive these first doses, represent thousands of healthcare heroes in every corner of Vermont that with today's start will be getting their vaccinations in the coming days and weeks. That's incredibly gratifying because these healthcare heroes, while suffering the same personal tumultuous times that we have caused by COVID, have every single day put their lives on the line to go to work to keep us healthy and safe. And it's with great gratitude that we now can return that favor and do something that keeps them safe. In Vermont, we're very fortunate having the leaders that we have. Governor Scott, Secretary Smith from the Agency of Human Services, Dr. Mark Levine, and all that work for them have given us guidance based on good science. They have brought to us ways to approach the epidemic that has kept us safe, safer than many around the country. You know, in tumultuous times like this, the information flow can be disrupted, and we have to be flexible. We knew that vaccines were coming sometime this week, and we had created plans to start these vaccinations. The vaccine actually wonderfully showed up earlier, and we adjusted our schedules so that we could begin vaccinating our healthcare workers and others as soon as the vaccines arrived. So again, we've had great partners in the leaders in the state of Vermont. They've given us great guidance and advice. And I'd like to turn to Secretary Mike Smith, the Agency of Human Services, to make a few remarks. Thank you, Secretary Smith.
Thank you, Dr. Brumstead. It's an honor to be here. When Dr. Brumstead speaks of partnership and of working together every step of the way, he's not exaggerating. All of Vermont's hospitals and healthcare partners have worked together in concert with the state, and I know we've saved lives as a result. The latest surge in cases has been a terrible reminder that despite our great work, this virus is persistent, and its impacts can be fatal. As the virus rages on, it is taking our toll on our healthcare workers, and we know you are tired. I can think of no greater gift after such a long, hard year than the relief that will come with vaccines. As I said earlier today, Vermont needs hope that the end of the pandemic is coming. With today's vaccines and thousands that will follow over the next several weeks and eventually months, Vermonters can be hopeful that over time, they will once again be able to go about their daily lives without the fear of contracting the virus. Until then, we must continue to do the things that have proven to slow the growth of COVID-19, such things as masking, distancing, and hand hygiene. And this applies to those who are about to become newly vaccinated. I want to personally thank the individuals here today who are setting an example for others who will follow. It is so important that we move as quickly as we safely can to vaccinate Vermonters, and you are paving the way. In the months to come, more groups of Vermonters will be eligible for the vaccine. But in the meantime, we must not let our guard down. Again, thank you, everyone who helped make this possible. Today is a day many of us will never forget. The end is in sight, and thank you for having me here today. It's an honor.
Again, thank you, Secretary Smith. Thank you for joining us today, for your kind words and for your leadership. Now I'd like to turn this over to Dr. Steve Leffler, who's the president of the UVM Medical Center, to get the show on the road. But before I do that, I really want to thank Steve and his leadership team for the tremendous effort and work throughout the pandemic, and also their flexibility in being able to get the vaccine off the shelf and into arms as quickly as possible. So thank you, and take it away, Steve.
Thank you, Dr. Brumsted and Secretary Smith. This is an exciting day for Vermont, for all Vermonters, and for the healthcare delivery system. For 9 months, we've asked Vermonters to sacrifice getting ready for today when vaccine is here, and we get to start taking away the virus's spread in Vermont. It's a big day. With us today are the first individuals who will be vaccinated, and this group includes more than just UVM Medical Center employees. As you may know, the hospitals across the state of Vermont have stepped up to lead distribution of vaccines for our community healthcare providers as well as our staff. We are proud to be joined by emergency services personnel from Essex Rescue and Williston Fire Department as well. Thank you for all you've done in the pandemic and for being here with us today. Our UVM Medical Center staff are represented by employees who care for COVID-19 patients on a daily basis, and who are those who are most at risk for coming in contact with the virus through their work. We will be carefully distributing the vaccine to the rest of our staff in the coming weeks, following a protocol to make sure that the most at risk get vaccinated first. But in the next month or so, we should be able to get almost all the medical center staff and our community providers vaccinated. So really an exciting start. I'd like to introduce the first Vermonter to get the vaccine, someone I've known for a really long time, Cindy Wamsgamps. Thank you, Cindy. All right.